Hey everyone, welcome back to the Mr. Steve English podcast. I'm your host, Steve, and today's episode is going to be super valuable, especially if you're in the medical field. Now, let me ask you something. What's more important, medical knowledge or the ability to communicate it clearly? Because honestly, even the best doctor can struggle if they can't explain things in simple English. That's exactly why today I've invited a very special guest. She's experienced, professional, and amazing at patient communication. Please welcome Dr. Amelia.
Hi, Steve. Thank you so much for having me. I'm really excited to be here today.
We're excited to have you. So, Dr. Amelia, today we're talking about something very practical. Medical English, essential phrases for doctors. Why is this topic so important?
Great question, Steve. You know, in medicine, communication is everything. A patient might not remember every detail of their diagnosis, but they will remember how you made them feel. If you speak clearly, kindly, and confidently, you build trust instantly.
That's powerful. So today, we're going to help doctors and medical students sound more natural, right?
Exactly. We'll cover real phrases doctors use every day, from greeting patients, to diagnosis, to giving instructions.
Perfect. Let's get started. All right, first impressions matter, right?
Absolutely. When a patient walks in, they might feel nervous or scared. So your first words should be calm and friendly.
Give us some examples.
Sure, a simple one. Hello, I'm Dr. Amelia, and I'll be your doctor today. Very clear, very professional.
Nice, simple and effective.
Another one. How are you feeling today? It shows care, not just professionalism.
Yeah, it feels human, not robotic.
Exactly. And one more. Please take a seat and tell me how I can help you.
That sounds very welcoming.
Yes, it encourages the patient to open up.
All right, now we move to the important part, understanding the problem.
Yes, this is where good questions matter. Start with, can you tell me about your symptoms?
Open-ended question. Nice.
Exactly. Then you can ask, when did the symptoms start? Have you experienced this before? Are you taking any medication right now?
These sound very natural, not like textbook English.
That's the goal. Patients should understand easily.
And doctors should listen carefully too, right?
Yes, listening is just as important as speaking.
Now comes the serious part, diagnosis.
Yes, and this is where many doctors struggle with English. You need to be clear, simple, and calm.
Give us an example.
Sure. Based on your symptoms, it looks like you have the flu.
Simple words, no complex terms.
Exactly. Another one. This is a common condition and we can treat it easily.
That sounds reassuring.
Yes, reassurance is key. And if needed, I'd like to run a few tests to be sure.
That keeps the patient informed.
Always keep them informed. It builds trust.
All right, now treatment time.
Yes, and this part must be very clear. I'm going to prescribe some medication. Take this medicine twice a day after meals.
Specific and easy to follow.
Exactly. Also, make sure to drink plenty of fluids. Get lots of rest.
Classic advice.
Yes, but very important.
What about follow-ups?
Good point. Please come back in a week for a follow-up.
This might be the most important part.
Absolutely. Patients can feel anxious or scared. So say things like, you're in good hands. We'll take good care of you.
That sounds comforting.
Yes. Also, don't worry, we'll monitor your progress.
A few kind words can make a big difference.
Exactly.
Let's make this fun. Doctor types.
All right. General practitioner, GP, your family doctor. Pediatrician, treats children. neurologist, brain and nerves.
That one sounds complicated.
Yes, but useful. Dermatologist, skin, cardiologist, heart, dentist, teeth.
Simple categories make it easier to remember.
Exactly.
Now let's switch roles. What do patients say?
Great idea. I've been feeling unwell. I have a headache. I think I have a fever.
Very common.
Yes, and also, do I need any tests? What are the side effects?
Important questions.
Doctors should be ready to answer clearly.
All right, Dr. Amelia, give us some pro tips.
Sure. Use simple English. Avoid complex jargon. Speak slowly and clearly. Always check understanding.
How do you check understanding?
Ask, do you understand? Do you have any questions?
Nice. Simple but powerful. This has been incredibly helpful. Before we wrap up, any final advice?
This has been incredibly helpful. Before we wrap up, any final advice? Yes, practice every day. Even 10 to 15 minutes can improve your confidence. And remember, good communication can save lives.
That's powerful. All right, everyone. That's it for today's episode of the Mr. Steve English Podcast. If you found this helpful, like, share, subscribe. And don't forget, practice your English every single day.
Thank you so much for listening.
See you in the next episode.